My name is Katie Kyle, and this is for my straight cath remediation. So we do have our patient, Mary Sanford. She was born on 11/12/98. She is full code. It is listed here that she has no allergies, but I am going to double check with her when I walk in the room just to make sure, because there are iodine and latex allergies that can be associated with catheters. She did just have a vaginal delivery of her first child 6 hours ago, and is currently on levothyroxine and a prenatal vitamin. She lives with her husband in an apartment. All of her vital signs are within normal range. She is grimacing with pain, which is to be as expected post-birth. She has normal bowel sounds and breast sounds are clear. Everything else is within normal limits. She is having some urinary retention and having a hard time urinating. So we did do a bladder scan, and there is a large amount of urine in her bladder. So we are the doctor has ordered a straight cath. And they did order that for now. So I'm gonna go check with the patient and make sure that she's okay with that. Hi, my name's Katie. I'm gonna be your student nurse. Can I have your name and date of birth today?
Mary Sanford, XX.
Perfect. Congratulations on your first child. How are you feeling?
Oh, mostly good. I just kind of have to pee, but I can't.
Yeah, that's what I was hearing. So the doctor, we did do that bladder scan, so you do have a bunch of urine in that bladder. So the doctor wants to do something called a straight catheter. It's like the Foley catheter you had earlier, except there's not a balloon on it. So then we'll just, after the urine drains from your bladder, we'll just take it right back out. Is that something you'd be okay with today?
Yep.
Okay, perfect. And I will grab that, but right now, is there anything else I can do for you? Are you having any pain or anything like that?
Nope.
Perfect. And I do just want to double check your allergies. There's none in the chart, is that correct?
Correct.
Perfect. Specifically latex or iodine at all?
Nope.
Betadine, not iodine. My bad.
No allergy.
Perfect. Okay. Then I will go grab all of that and make sure. But before I go do that, I am going to put on some gloves. And I am just going to pull down your blanket. Is that okay?
Yes.
Perfect.
Sorry.
Okay. And we are going to inspect that area. It does look as expected post-vaginal birth. A little bit of redness and swelling, but again, that is as expected. So I can go now and grab my supplies. I am gonna have an aide come in here and do some peri-care on you. Is that okay?
Yep.
Perfect. I will have them come in while I go grab everything.
Okay.
Closing the curtain for patient privacy, and before walking in, I did close the curtain for patient privacy and perform hand hygiene before talking to my patient. Okay. Now that I am back in the med room, we do have our catheter kit. It is ordered for now. It is a straight catheter. It's open urethral tray with vinyl catheter. It's a 14 French. It has not been opened or tampered with. There is no latex in here. And it is for prescription only, which we do have. And it is not expired, and all the dates on this are good. So now we are going to go back in. But before I go into the room, I am going to take off my rings just because that can kind of mess with the sterile gloves. Performing hand hygiene, maintaining patient privacy. Hi Mary, how are you?
Good.
Can I have your name and date of birth again for me, please?
Mary Sanford, XX.
Perfect. This mannequin does have a broken arm, so I'm sorry. So you're still okay with having that straight catheter?
Yep.
Okay. And did that aide come in and perform some peri-care for us?
Yep.
Okay. I am going to get the bed up to working order, and then I am going to go over to the other side to grab some gloves just so I can set her up. Okay, do you have any questions before we start?
No, I don't think so.
I'm just gonna pull down this blanket, and I am gonna pull it all the way down just so we have clear areas. If this was my actual patient, I would fix these sheets because they can cause issues. And I'm just gonna lift up your gown. And again, as expected, we can see that the aide did come in here and they did chart it. We are gonna open the legs just for ease of access. And I am gonna put this down so I'm not leaning over it the whole time. so we can see and check that everything looks as expected. And I am going to maintain patient privacy as much as possible, even though it is hard with this procedure. Okay, my dear. We're going to do that catheter now, okay?
Okay.
So we are going to make sure that this is up to at least waist, if not higher. And we are going to start with opening it, and I want to make sure that I maintain sterile field. So we are going to open it away from ourselves. And then everything I'm dropping after this is going to be above waist height. So I am just going to move that garbage can up a little bit. I do need to go grab a proper disposal bag. I will ask my aide to go do that very quick. Can you go grab a red bag?
Yes. I just didn't know what to do with the camera.
Yeah, fair enough. I wouldn't either. So as I am having my aide do that, I can just again check to make sure that there are any questions or concerns with that. Normally in a hospital setting, I would put on a staff light or something around that nature so nobody would have to leave the room and we could continue with our procedure and make sure that the top is not open for an extended period of time. Okay. They currently do not have any of the proper disposal bags in the lab, but we would have a red biohazard bag which we would dispose everything into. Okay, so now that I'm going to start, I'm going to straighten this out just for my thing, and we're going to grab the sterile gloves. So right now I can touch the outside, but I am going to have to open it. And now I can only touch the inside of it. So I am going to open it as much as I can, and we do have that 1 inch unsterile around the corners. So I can touch the outside, I just can't touch the inside, so I can try to flatten this out as much as possible. We do want to start with our dominant hand, so I am going to grab the outside. And don my sterile gloves. And I did not touch the outside, I got my hand on the inside. And then this glove is still sterile, so I am going to go underneath and apply that other sterile glove. So I can no longer touch the inside of this glove, but I can only touch the outside. And I am struggling a little bit with my fingers. There we go. And we can do that. And now if this glove was still up, I could pull it down a little further. Now I can grab the inside and drop into my garbage can. And I did miss, but we can always pick that up later. That is not my current issue. So now we can do this. We can see with this we have the shiny side and the more matte side. The more matte side is more absorbent, so that is the side we want up. And we just want to make sure that, that was harder to open than normal, that it does not contaminate and it's just extra protection. And now I can move this because the top of that is still sterile. Then we do have the drape for the patient just to make sure everything is staying. Normally these are for the legs, but I find it easier when it is this way. Again, we do have that shiny and that matte side. And again, just to be careful to not touch the patient and just have everything in your sight. Okay, and now since I am still here, I am going to open the cleaning strips, and again, dropping above waist height. And I am going to set everything up. Because this is a mannequin, we are not going to be using the loop today. And then for this, we are making sure that is inside, and we are placing it towards the back, but close enough to the patient that it is good. Now I'm going to designate my left hand as my no longer sterile hand, and I'm going to spread this. So now I can no longer touch anything that's in here with that hand. I am then going to grab each stick, and I'm going to start from the top down, starting away from me. I'm gonna pull away. The second one on the way close to me. Making sure to not contaminate the sterile field as much as possible. And then that final one just to go down the middle. And this is the point where if there was extra cleaning, I would go and do that. Okay. I am then going to go inside. This is normally the part where you would put the tip of the catheter into lube, but again, I am not going to do that with the mannequin. And then if we needed somebody to be in here with a flashlight for a different anatomy, we could as well, and that is something that I could delegate. So now I am going to take the tip and insert it in. For a female, it's about 2 to 3 inches or until the urine flows, and then for a male, it is about 7 to 9 inches or until the urine flows. And then I'm going to let that stay inserted until all of the urine is drained. So now the urine has stopped. I still have this as a sterile hand and this as an unsterile hand. And if we did have urine in this cup, we would determine the color, if it was cloudy or not, so the appearance, and if there was a smell, and we would report that to the doctor and also make sure it was correctly documented in the chart. That is when I am going to tell the patient to take a deep breath, and I am going to pull it out and drop it. Okay, now the sterile procedure is complete. I'm going to make sure that my patient is okay and comfortable, and I would put this off for a urine sample if needed, and I would touch that with my sterile glove because that's still in its sterile environment. I am then going to wrap everything up and then proceed to put it in the biohazard bag that was not provided. And then I would throw that away in the proper container. And then for the gloves, I'm just gonna doff them. And now my sterile procedure is complete. I am then I would put on different gloves to take care of this. But again, those would be my biohazard bag. My dear, how are you feeling? Are you comfortable? Yes? Okay, perfect. And then would straighten her legs back out, make sure that she's in a comfortable position, do pericare if needed, make sure that she got everything that she needed post that procedure and make sure that she was comfortable. I will then cover her, make sure the collet is within reach, and put the bed in the lowest position and make sure all safety features are in place. Okay, Mary, that went really, really well. We'll check back in a couple hours. We do want you to void within a certain time frame after having that straight cath, so we will be checking up on you, and if you do pee, just call and let us know, okay?
Okay.
Is there anything else I can get for you at this time?
No, I don't think so.
Okay, perfect. Then I will see you later, okay?
Okay.